Hey everybody, let's get started. My name is Griffin Cole. I have the honor of introducing our first speaker. Xerxez Calilung graduated from USC and has been an adjunct professor there since '93. He's been working with stem cells and exosomes since 2017, so this is like very early cutting edge. Treated over 1,000 patients, or close to 1,000 patients. And more importantly, I got to know Xerxez because I spent a weekend with him. I actually went to California to learn what he did thanks to Jeff and Medco. And it was quite an experience. They have an incredible cutting-edge lab there with Kerner, and you learn the whole process. He shows you case examples of dramatic changes in people's health. And I just learned a ton, and I was so excited. I said, you got to come speak to us, and I'm going to have you back again with Kerner as well because they're doing amazing things. So without further ado, Dr. Xerxez Calilung.
Thank you. Thanks, Greg. So my AGD disclaimer is I do not have any financial interest of a product in my talk with any company offering grants or money or a continuing education and medical education program. I'm strictly a research guy. Wet finger dentist. I don't have any other degrees other than being a dentist. And so let's get going. Just before I got started, I was asking a couple of people out in the audience what you guys wanted to get out of this this talk today, and so my expectations for you is that after today, you're gonna kind of have an idea of what kind of biologics to use right straight out of the bat on Monday. Stem cells, exosomes, amniotic fluid, PRP, or any other biologics that are out there that you might be familiar with. And so here we go. Come from a family of dentists, mom, dad, myself, general dentist, and my daughter, who is a pediatric dentist, and so she trumps us all because she says, Dad, I'm a specialist. And I said, yeah, but I'm still doing all your root canals. So, guys, as far as dentistry, our scope of practice is really the whole body as it pertains to the mouth. And so that's what this group is all about. It's comprehensive medical and dental. So again, the California Practice Act has something for stem cells. And this has been there for a long time. And so, again, our scope of practice in terms of stem cells and biologics is definitely expanding. So, this is for California, but there's something similar for other states. So I just kind of want to maybe just ask the dental board within your state in terms of what's going on as far as using biologics in your state. And if you scan this one is, again, is specific to California. And so there's a lot of cool things happening as far as California, as far as biologic stem cells and exosomes. I don't have to speak much to this group about how interconnected everything is. And like with the speakers this morning, we talked about inflammation. We talked about pain, we talked about airway, and the stem cells and the exosomes are really just another tool in your toolbox and armamentarium to go ahead and do the things. You still have to do all the structural stuff. You still have to do your root canals and your crowns and your bridges and your dentures and your appliances and your bite guards and everything like that. And so this stuff doesn't take it away. Another doctor asked me, he's like, so what do you expect for your stem cells? And a guy goes, grow teeth. I said, not going to happen. He goes, but it will do is help in the healing process, just like the previous doctors from this morning, is to accelerate the healing processes that has been shut off, basically. And I have been seeing a lot of post-COVID patients that have been suffering with long COVID. And so a lot of the biologics that we're using, along with vitamin therapy and just good overall health and good periodontal oral health has been reversing our patients into getting better in terms of COPD, in terms of diabetes. A1Cs are going down. Some people have autoimmune diseases where their symptoms are super exacerbated, and that we're also being able to reverse it, not heal it, but reverse it. So I'm a general dentist, and I know you guys think it's like, you're getting really close, but I don't have to say that much because this group understands that our scope should be working with the medical doctors, and to the point where there's really no blurring of that. But I do practice with a medical doctor in my practice so that we can treat specifically diabetes in my practice and treat autoimmune diseases in my practice. And so again, but you have to have some type of partnership. I do also have, like dealing with headaches, I sometimes refer to a neurologist so that we can work up the people that are maybe not so much straightforward, that's myofacial in nature. Maybe they have a psychological problem in nature. Again, so I have no problems working with other medical doctors to help our patients get better. So here it is, guys, and as far as what's going on with the oral health and medical health, so I see a lot of older senior patients. And as our population grows, it's just going to be much older patients. My dad has been smoking since he was 10 years old, and he's now 88. And this guy is not going to stop smoking, but longevity is on his side. And smoking and the lungs and the heart and oral disease, so if we can improve on all oral health, all these other things can do as well. With heart disease, again, well established. I don't have to say anything with this group. COPD, get our mouths healthier, the lungs get better. Cholesterol, get in the lungs again, get our mouths healthier, everything gets better. And then the liver, as far as periodontal disease, that all gets better too. And as far as diabetes, I would say, within our practice, there's always, at least in Southern California, I see about 50% have some issues with pre-diabetes and diabetic conditions. I don't know what it is for your practice. I'm willing to guess that it's pretty high. And that's just the American diet of fast food and sugar. And again, periodontal disease with a lot of the cancers and kidney disease. So hopefully, so 50% of my time I'm going to be up here, I'm going to be talking about stem cells and how to use the stem cells in your practice. And then the next half, I'm going to be talking about exosomes. And also, I'm going to be showing you how to administer both the stem cells and the exosomes. So you're going like, well, the only way I know that stem cells have been administered is through IV. And so I will show you an alternative of delivering stem cells in dentistry in the oral cavity. Again, I see a lot of patients, again, comorbidities when patients are coming in for oral conditions with comorbidities of psoriatic diseases and arthritic diseases. And it's a huge population of osteoarthritis always coming into my practice. And so kind of just take a look at what's going on. Okay, here it is. This is where we live. What's so special about it? Spit, man. I love spit. The more you drool, and I'm not connected with that saliva test company that's out there, but seems interesting. I just don't know what they're testing for, so I'm going to go and check it out, see what's going on. But what's really good with spit it's filled with peptides and exosomes because we naturally have that in our body. But the magic of saliva are these little peptides. And one of them in particular is this peptide called LL37. And LL37, actually, you can buy that from Amazon for $500 per 5 mil. And you can buy anything from Amazon. You can buy bone morphogenic protein from Amazon and then do all those things and put it in your body and create bone. The only problem is it creates a lot of bone, and it doesn't know when to stop. It's like teaching a monkey. I always say about in dentistry, I can teach a monkey how to do dentistry, but I can't tell it when to stop. That's the difference, but a very fine line, but we're a little bit more advanced, obviously, than dental monkeys. Again, LL37, and its antibacterial effects. That's what's so special about spit, is it just prevents us from getting sick. There's everything that we throw in our mouths, as little babies, we walk around and do like this and touch things. It's like, oh, no, don't touch that. I said, no, man, let the baby touch it. Yeah, it's like, and the body just knows to say, hey, I'm going to go ahead and I'm going to protect you. By the way, LL37 is in all fluids that protect you, which is the saliva, the tears, mother's milk, and women's menstrual flow. And in fact, in India, they try to sell this stuff, the LL37, and they try to extract it from women's menstrual flow, and for some reason, it just didn't sell very well. So anyways, exosomes is naturally occurring in our bodies. Okay, it's no magical stuff. It's what we have already. As babies, we have a ton of it. As older guys and older folks and seniors, we have a little bit less of it. So our goal is to get more of these exosomes and stem cells and stimulate it closer to the baby, okay? So that's our goal. And somehow get it into our bodies some way or the other. So these exosomes and stem cells, also let's go back a little bit. Stem cells is like the healing cow, okay? You put the cow next to something and it just heals. And the exosomes is the milk that comes from the cow and heals also as well. So it's an extract. The difference is the magical cow, which is the stem cell, can produce more of itself, more cows, and more exosomes. Exosomes is very limited. You put it in, but these limited things are very strong because they are computer programs that tell your body what to do. Now, if your body doesn't have an ask to repair, these exosomes do absolutely nothing. So if you're healthy instantly, you took exosomes, didn't do anything for me because this stuff's just bogus. But if you have osteoarthritis and you have a wound that doesn't heal and the bone is not healing and things are just going crazy, and you take it and it's like, oh, your ability to heal is accelerated because of that environmental ask that your body is screening for, and the exosome goes, okay, I got it. I got the message. And it starts all these biologic processes to start healing and accelerate the healing process. In those exosomes, they have these little antennas or factors. CD is cellular differentiation or cells of differentiation. And the exosomes that we like to see is CD9, CD81, and CD63. Those particular CD factors are responsible for anti-inflammatory, angiogenesis, and all the things that are used for repair. Just as an aside, for all those numerology people that likes to look at the numbers, the numbers 9 and 9 is the symbol of all things that is good and all the things that God gives you as good. So throwing the 9. I'm just not, this is not scientific, but it's just entertainment value. CD9, 8 and 1 is 9, and 6 and 3 is 9. So anyways, here we go. So how do we get these stem cells in the mouth? If you can't do IV in our practice, and we don't practice with a medical doctor, well, my thing is, if I put it in the mouth, our environment is blessed with a lot of lymph nodes. So the lymphatic system, so quick quiz, where does the lymphatic system drain into? The venous system, right? Vena cava. And where does that go? Into the heart. And where does that go? Into the circulation. Alternative to IV infusion is to put the stem cells and exosomes in the mouth with the parotid lymph, submandibular lymph, and the mental lymph node and preauricular lymph node. Anyways, there's a lot of lymph nodes in that area. Here's a little map and a little abstract of let me see, that the stem cell, so this one was the intralymphatic administration of the stem cells. And so what I did is I started looking for an animal study of the distribution of stem cells through the lymph nodes, and we found this zebrafish example. And so they injected the stem cells into the lymph node of the zebrafish that had a necrotic tissue in the heart, and all of a sudden it regenerated that necrotic portion of the heart. So if we had to go outside of the dentistry, and if you were working with a doctor, I would inject those stem cells into those joints that have high lymphatic tissue to go directly into the area. Or you can just say, since this knee or this joint is hurting, then I could just go ahead and put it in there. But it's really going through the lymphatic system. And I'll tell you more about why the lymphatic system is so important. It has something to do with T cells, just like you guys heard from earlier this morning. And that's really cool stuff, too. So anyways, you got that, all the lymph nodes. And so how many people can do a buccal infiltration here? Then you guys are all stem cell dentists, because that is about the skill set of what you really need to do in terms of just the ability to do the stem cell injection. It's knowing when to stop and when to start is what differentiates you. And that's why everyone who has a piano is not Liberace, just because they own the piano. And just because you own a hypodermic needle, you're not a stem cell dentist, because you don't have to know when to start and when to stop. All right, here we go. So the next question is, do all stem cells become cancerous? I've been hearing about all this stuff. It's like, I'm not taking that stuff. That's going to be cancer. Yes, embryonic sources of stem cells can become cancerous. But as it goes down the embryonic water flow, and it becomes into the multipotent stages where it's actually differentiated into a tissue, what some researchers have done has had the ability of reversing it from adult tissue or just regular tissue and put it back into the ability of becoming a stem cell. So it's in that multipotent level. It doesn't go back to the totipotent level to become cancer cells. So it's kind of like, so you have to be able to see this waterfall of development. Once it's gone down here, it's chosen the non-cancerous path. Does that kind of make sense? Again, stem cells, they just love to make more of it. And so it's not really the stem cell that's doing the work. It's everything around it and all the side actors around the stem cells. Okay, so they're making the exosomes and the signaling molecules do all the work. There was a lot of stuff in terms of like dental, like all the different sources. Like, why did I pick like cord tissue stem cells as opposed to like tooth harvested cells from the like baby teeth? I know the pediatric dentist over there. How popular was that harvesting baby teeth to go? There's not enough of it to make any significant things. And so also from blood. But again, with blood, they weren't able to harvest as much of the stem cells from the blood, which is with PRP. PRP, though, is your own, and so you're basically spinning out and getting whatever exosomes that are coming out of that PRP. And so it's kind of like exosome light is what I call it, is for PRP. And it also, when you're spinning it, is you also have a little bit of what I call cellular trash that gets kind of mixed in with the PRP. So again, it's the source of the tissue that makes and determines the efficacy of that stem cell or exosome. And a lot of these sources are really from baby tissue sources like the umbilical cord or cord blood. And so the reason I also chose to do cord tissue stem cells is that it's one of the most studied. And we know that when we get the tissue, again, the cellular differentiation, the CD numbers, we know that when it goes into all those different tissues, we can see the different CD markers being distributed into the different tissues that these stem cells are making. And this is the guy that figured out how to get adult tissue into stem cells. And he did his proprietary wash, and he's from the Midwest, and he's just really super smart. I met this guy like almost 5 years ago. And so what he does is he strips these little parasites off the tissue and turns them into mesenchymal stem cells. It's about as easy. It's a cartoon version of how he makes the stem cells. He just kind of does this little magic potion, and he strips it, and he says, "Okay, guys, let's go over here, and let's not become a tissue." And so it's kind of a jigsaw puzzle that he just takes off the little pieces and then uses those. And those little pieces of the jigsaw puzzle are the actual stem cells that go in. But it's a major piece of the puzzle that if you don't have it, it doesn't start, or it doesn't look great. So again, that's the general dentist version of the explanation of how stem cells are made. So they're not killing babies. So get that out of your mind. They're basically healthy baby-born babies that are from healthy mothers, healthy babies that choose to say, yes, I would like to either keep it for myself or donate it or dispose of it. And so you cannot sell like baby tissue. Okay, so, but interesting thing enough is if you save it for yourself, for your family, you can only pull it out if it's an emergency or life-threatening emergency, and you can't pull it out for you to have any kind of cosmetic procedure for yourself. So read the fine print. How are we doing? Again, I chose to do the umbilical cord studies is because it's got the most studies in the literature. We could have gone through other things. I also tried to do adipose sources, which is fat sources for the stem cells. And I was doing it for regenerating gum, and that didn't work out that great. And so I kind of got disillusioned, and I said, I'm not doing this anymore. But stem cells started coming in. Okay. So one thing about stem cells is after injecting it, someone from the audience said it's like, it doesn't work that fast. Well, it depends on what you're asking it to do. If you're asking it to create new tissue and new joints and stuff like that, it goes, absolutely not. After the injecting of the stem cells, it just doesn't create new bone and new tissue like overnight. It takes months, years. And so some of the injections that I've done have been over 4 years, and we do see TMJ repair. We do see bone density repair. And so, and the cool thing is we do see scar tissue melting away into the areas where there's old scar tissue. I know it's because I had a motorcycle accident, and I have broke my collarbone, and then put some stem cells under that, and basically the keloid, Asians are notorious for having horrible keloids, and the thing just melted away. So cosmetic use, absolutely. Some people that have little scar tissue and like that, you can inject it and ask your dermatologist to go ahead and do that, and also use exosomes. But the thing that I wanted to tell you about is what stem cells do instantly is inflammation. The anti-inflammatory effects of stem cells are pretty good, but there's something that's even better, is amniotic fluid. And so I'm kind of like going through a little bit. It's just I'm mixing in stem cells and exosomes and amniotic fluid because it's kind of all the same source. It's basically the birth. And the reason for the amniotic fluid is because it's everything that the baby needs is just there. And so I see larger amounts of anti-inflammatory factors and cytokines and growth factors in amniotic fluid than stem cells. But then again, it doesn't reproduce itself, and it's very limited in terms of what it does. So after it gets used up, it gets used up. So, but if you're looking for something immediate effect, amniotic fluid is not a bad way to do something if you're not expecting it to do long term. Is that helping? This slide shows you the immediate effect of inflammation 5 minutes after the injection. It just goes from high, inflammation low. I know this is because when I do the stem cell injections intraorally for my patients who are nearsighted, all of a sudden can see clearly within 5 to 10 minutes because of the inflammation of the eye. Before, because the eye was so inflamed that the cornea was not able to bend to correct the vision, and now that the inflammation of the eye became decreased, the cornea was able to bend, and that's actually able to make a clearer vision because of the reduced inflammation of the eye. Very limited though, but that's what we saw when we did the injections immediately. All right, here we go. So the stem cells, when we do this, the pathway of what it makes is a lot of these T cells and lymphocytes. Basically, all the components of an immune system is really what it starts to make. And just like the guy, the doctor earlier today, you know, like boosting the T cells is really what it's all about. And remember the thing I told you about? It's like 99.99% of what it's super effective for is the pain, osteoarthritis. And TMJ, that's the only thing that I know is that the pain. And so I actually have much more successful treatment of TMJ pain with amniotic fluid and immediately. And stem cells are really more long-term. And then the exosomes, I'll tell you about it a little bit later, because that's the next half. All right. How do we know that, how many stem cells are there? There's actually a machine that looks at it and says, hey, how many stem cells are in here? And it just counts. And this machine just tells you the concentration. And the red spots are basically the high concentration of the stem cells, and that's exactly where you want it to be. And when you order your stem cells, just ask them for a biologic report. It says, show me that it's clean. And then you've done your due diligence that says, hey, I've gotten this stem cell from this company. When I got it, it's clean, it was frozen, And I did it, and I did it in the right amount of time. I didn't leave it out. I did it within like first 5-10 minutes, and there it is. And so there's very, very little risk of infection because you take it out of the vial, you go to your patient, you put it in. So the risk of infection is about the same amount as you giving a buccal infiltration to your patient going like this, which is pretty close to zero. And if you want to, you can do some Paradex mouth rinse and everything and prior to go ahead and injecting the stem cell or the exosome. Okay. Certification reports, biological reports, just ask for them and then they'll send it to you. Again, stem cells, they're like, what do you call these things? The Jedis, they say, these are not the droids you're looking for. When the stem cells go in, how does the immune system go say, hey, you don't belong here? And the stem cells go, we're not the people you're looking for. It goes, oh, okay. They're completely immunoevasive because even though it's not yours, because they're a universal cell, they just play well with others. And they make more and more and more of each other. And again, they're basically mobile drugstores that respond to whatever the body says, hey, something's wrong. My nose is dripping. Can you fix it? It goes, oh, okay. I got a cut. It's got a bunch of bacteria. Can you fix that? Sure, I can do that. Oh, okay. So the stem cells, so you get a T cell, and then the stem cells, and the monocyte, and this other monocyte, and it becomes into this little biologic soup that combines, and it becomes a regulatory T cell. Okay, that's where the T cells come in. Okay, and they go into a filing cabinet that's available for storage for whenever you need it later on. And so I'm going to need it for chronic infection. I'm going to need it to fight that cancer. I'm going to need it for my other allergies and autoimmune issue. I need to be able to help with the pregnancy. This is why your body was built to do this, but your ability has decreased is because you have lower amounts of stem cells, lower amounts of these signaling molecules in your body. And again, the directive is to increase all these amounts in our body so that we can do what we were built to do. Again, in the news, first woman to be cured of HIV by stem cell transplant. California just spent $5.5 billion of taxpayer money to put into stem cell research. And so hopefully we'll be asking the state legislature to extend our scope of practice to be able to do education in stem cell therapy for all Californians using Prop 14 money. So I don't know what's happening in your state, but you can use us as an example of what direction we should be going. And these guys, some are not around, some were used stem cells to basically extend their ability to go ahead and do something. So amniotic fluid, did a lot of it, exosomes, cord stem cells. But what I kind of want to do is I want to get into doing exosomes. And so, but I want to show you really quick, okay, it makes bone, great. It gets gums, great. But you know what? People don't spend like thousands of dollars in these. They goes, hey, I want more bone and I want more gums. You know what they really want to come in is like, you know, yes, I have got gum disease, but man, I've got, my knees hurt and this thing hurts and I don't have enough energy, and the thing's like, hey, we can help you with your mouth, but we can also help you feel better and have more energy. And even though, again, we're able to, by the way, so we're using stem cells and exosomes and all these things for root canal rescue, implant rescue, and to accelerate orthodontic movement. Because it's amazing because it does a lot of things for osteoblastic and osteoclastic activity. And because of the T cells and all those things in there, it's able to keep the infection down. And then this morning when we were talking about the removal of the infection around the implants and the teeth and removing a lot of the dead tissue. So if you're not ready and the patient's not ready to do that, there is a non-invasive way to rescue that tooth by maybe first trying a little bit of the stem cell right under the buccal of that area and allow the body to say, hey, I'm injured, can you fix me? Why don't you give that a try? Believe me, your patient might be going like, oh, you're not going to pull my teeth? And I'm not saying that it's going to work, but I'm willing to bet that that patient's going to say, you know what? I'm willing to try that before you rip this tooth out. Because that tooth may be pivotal in your treatment plan for a lot of other things. And now you've kind of just opened up your treatment plan. I save a lot of teeth, but my patients are not excited. They go, look at the bone. Look at this. Like, that's what you're supposed to do. But look, I can run and I can move around and do all those things. They're super excited about the non-dental comorbidities that they're able to do more because you help them with their mouth. Okay, I got to get into the exosomes because that's really the part. So I inject the stuff, okay? I inject so you got that part. You inject the stem cell, inject the exosomes into the mouth. You do a buccal infiltration. You get it somewhere near the, what do you call it again? The lymph nodes, and it just knows where to go. And sometimes it's just, like you put it into the site where the tooth is really broken, and you go ahead and do it. And sometimes it's a site that's a little bit distant, but it knows where to go. Because it's a little antenna that says, oh, hey, something's wrong with me, fix me. Again, I see a lot of compromised patients. All these stem cell patients are in your practice right now. Just look at that health history form. Look at all those comorbidities. They're there. And that's why you're doing this, is to help them with all those comorbidities that's associated with the oral condition. So go ahead and do your SRPs and do everything that you do normally, but add this as an adjunct to help you become successful. Okay, so let's move on. I gotta get through this really quick. Okay, ADA, this PRP. Okay. Osteoarthritis, this is the number one thing that gets really good at. Pain modulation. It stops pain. And I gotta show you this thing.
The trigeminal nerve goes like this. So you get pain jetting everywhere. Your jaw hurts and burns. Your teeth, the upper and the lower, feel like you need a root canal in each and every one of those teeth. Your face, you can't touch it because it just hurts, and you can trigger even more pain just to go like this. I would not touch my face to do that. It would, if I got in the wind outside, I imagine that's how sandblasting your face would feel. And that's not an exaggeration. Hi, my name is Nanette, and 22 years ago I was diagnosed with trigeminal neuralgia. Last year I came here to see Xerxez, and he always did my sleep apnea mouthpiece. But on this day in particular, I could barely open my mouth from the extreme pain. So I wasn't sure if he was going to be able to do the mold again, since it was broken, my original one, to do the mold again for my sleep apnea mouthpiece. I could not open my mouth but this wide to talk. And he asked me what was wrong because I never wrote it on my medical reports. And I told him trigeminal neuralgia, and he told me, oh, I can fix that. And I laughed. I said, I've had this for 21 years, 365 days a year, 24/7. I've gone to 6 or 7 neurologists, 3 or 4 pain specialists, and I don't know how many general practitioners. They have given me every medication on the market. They have done procedures on me that have actually caused more pain than they took away, and nothing ever worked. And now you're telling me you're going to fix this. And he said, yes, I guarantee you I'm going to fix this. And I thought, you know what? My Botox, one of the things is that I use to help me, because for the first 5 years of having trigeminal neuralgia, I could not sleep, I could not move, I could not do anything, completely debilitated, because I had the pain 365 days, 24/7, and the pain on a scale of 0 to 10, I would call it a 22, and that is no exaggeration. So I found that Botox would alleviate the pain. Of course, alleviate the pain was on a scale from 22 to like a 4. So I was still in pain every single day. And some days it would go up because when I came here, for example, Botox has an antibody in it that makes you resistant to Botox. So my Botox quit working. And I felt, when he told me that, I felt like I had nothing to lose. I had tried everything on this planet that anyone could find. And he gave me the shot of the stem cell, a stem cell shot. He first injected me to put my mouth to sleep on that side, on the side where I had trigeminal neuralgia, which made the pain even worse because he stuck a needle where the nerves were on fire already. And he said, but don't worry, I'll get rid of it. And I thought if he didn't get rid of it, I was going to kill him. So, but he did. He injected me with the stem cells. Between about 20 minutes, I was able to open my mouth. I was able to actually laugh. I was actually not in the pain that I was in when I came in, not even close. It was like the pain was going away, and it had been 20 minutes, which to me was like a miracle. By the next day, I had no pain. None. After 21 years, no pain at all. And I have not had pain. It's been a year now, and I have had no pain in my trigeminal nerve. Nothing for a year.
Anyways, I got to go really quick. Psoriatic arthritis, gone in 2 weeks. Pancreatic injury, gone. There's ICD codes for all these biologics that we do. I'll more than happy to share that with you. Again, there's Q codes for a lot of procedures that I have. There's a little code that you can kind of get on your phone, and I'll send you the forms. I have all the consent forms that if you want to go ahead and do and give your patients for the consent form. Exosomes is a non-living thing. These are the programs in your body. And I love exosomes is because it doesn't hurt. It's super safe. And I think this is really where we're going to be going to, because it keeps for a long, long time. It's like 2 weeks in a room temperature, 90 days in a fridge, 1 year in a regular standard freezer, and about 2 years in a -80 freezer. So in terms of storage, it's great. In terms of anti-inflammatory, it's really good. But what I want to do right now is I want to keep on going. And anyways, this helps with the multiple sclerosis mouse. It was paralyzed and it got better. But I want to show you the ways we're administering this. We're injecting it, topical, eye drops, inhalable. Anything that you can imagine doing it, we're able to do that to mix the exosomes with. Okay, again, these exosomes have CD factors of CD9, CD63, and 81, and we know it is because we have the spectrophotometer reading of exactly what we have in that sample. What I'm using the exosomes for right now are supplements. So I'm adding it into anything that you can eat or drink. So this is not in the purview of the FDA at all. And so, because they're proteins, lipids, and enzymes, and I see a lot of little light bulbs kind of popping up out there, there's zero regulation other than short of you killing your patient. They ain't going to bother you one bit. So it goes back and forth. You can make a big molecule, make a small molecule, make a small molecule, big molecule. And that's what enzymes that these exosomes do. They come frozen, and you can keep it in a regular freezer for 1 year. You can add it and then compound it in your office. I know that there's CD9, 63, and 81 is because it lights up like a Christmas light. And I can tell you each one every one of those exosomes are there. Naturally occurring. You add more exosomes, you get healthy. You take away the exosomes, you die. You get that? Really super simple. You add exosomes, you help with periodontitis. You add exosomes, you decrease the accelerated aging. You add exosomes, you help with hormone balance. My patients, I have 4 couples in my practice couldn't get pregnant. They took the exosomes and they got better. Kidney injury, heart disease, COPD. I'm just telling you that this thing is pretty good. Orthodontics, implant, myofascial pain, and anti-aging. So you put on your favorite cream, and you go ahead and do it, and so it helps. Stroke. And also, I do my dental compounding. I add to the antibiotics, and it helps with the antibiotics also as well. This is how I do it. I make my own Arrestin. Minocycline hydrochloride and a little bit of KY jelly. I send my 80-year-old dad to go back to KY jelly, and they said, "Hey, you're going to have a good time tonight, huh?" And he just says, "Oh, yeah." Anyways, I take this, and I put them into different compounds and carriers, and that's how I get it into my patient. They bring their favorite drink, I add it, and it gets better. That's a storage. I know it helps. It doesn't get messed up in the digestion. It's because mother's milk gets transferred into the baby and gets the benefit. The baby gets the benefit. That's how we buffer it. And if you don't like it, this thing also works in fruit juice also as well. I don't know how it works and how come it doesn't get degraded, but there's a study that does that tells you that these things are in the milk exosomes. Inject it, put it in the eye, topical. I even started making freeze pops. That didn't work that great. I use alpha lipoic acid in there because it helps with the bone. And then I put the exosome in there also as well as the vitamin C, and it helps with all these things. Alpha lipoic acid, this company called P&G, uses alpha lipoic acid because it helps with the bone regeneration and also helps with the nerve pain. That's associated with in periodontitis, diabetes, depression, dementia, and all these other things. But anyways, I just wanted to let you know is don't be afraid of biologics because it's just another tool in your armamentarium to really help the patient. Okay, so that's it. Thanks, guys. There's so much more, though, but... And so later, if you want to get, I can go ahead and get you the forms. Just if you just scan that and just fill out the form, and I'll go ahead and send it to you.
All right. Thank you, sir. Nice job. Make me feel better because I'm having stem cell injections in my knees in 2 weeks.